Good evening. Praise tonight for the work being done in the West Midlands to prevent people with mental health problems from ending up at accident and emergency departments or locked in police cells. The Care Quality Commission's found there's been a big drop in the number of people being detained in unsuitable emergency accommodation, partly due to projects such as the Street Triage Scheme. This teams police officers in Birmingham and Solihull with psychiatric nurses and paramedics for a faster assessment of those in need. And Jana Gadgill reports.
Meet Birmingham and Solihull's mental health triage team.
Driving is Dave, who's the PC on the car. We've got Will, who's the paramedic in the back, and my name's Tom, I'm the nurse in the car.
They respond to calls involving people believed to be suffering from mental illness.
Police or paramedics will get called out for reasons that aren't, I suppose, related to mental health on the face of things, but then when they actually arrive, there's a kind of bigger picture, and actually that's when they request us to go.
Soon we get a call from a concerned GP.
He's worried that he's going to either harm himself or somebody else.
The team heads straight there.
Will, the paramedic, will first of all assess his physical health. In terms of Dave, he'll look at the history in terms of risk, and then we'll do the kind of mental health assessment.
After a 40-minute chat with the GP and the patient, he decides not to come with the team. Fundamentally,
the A&E or a place of safety within a psychiatric hospital isn't appropriate at the moment. You know, the support is available in the community. He's agreed and consented to an appointment on Monday at 10 o'clock.
An outcome better for the NHS, the police and the patient.
Since the start of the year, the triage team has seen almost 2,000 people, of whom just 227 were detained under the Mental Health Act. That's down from 504 the previous year. And of that number, just 2 were taken to a police station.
Historically, we would have criminalised people, or at least perceived to be criminalising people under the Mental Health Act, because one of the things that we had to do was take them to police stations, and putting people who are mentally unwell into a cell is never the right thing to happen.
The trial's been such a success, the triage teams will now operate in the Black Country and Coventry. And Jana Gadgill, BBC Midlands Today, Birmingham.
Well, ideally, people experiencing a mental health crisis should be taken to an official place of safety. These are usually in mental health units with the resources on hand to make sure people can be properly assessed. And Jana is at the Ollie Astor unit in Birmingham right now. Are there many places like the Ollie Astor then, Anjana?
Well, Nick, there's 19 across 14 different hubs. There's 2 here at the Ollie Astor, although both rooms are in use, which is why we're outside and not inside. But they're quiet and basic rooms, far away from the police and away from A&E departments. And ideally, when the triage teams or the police detain somebody under the Mental Health Act, they would bring them to a place like this. And today, the Care Quality Commission praised the work here in Birmingham and Solihull, but said that the picture across the rest of the region and the UK wasn't quite so healthy.
Many places of safety simply are not available when they're needed. That either they're not properly staffed, or they're full, they don't have the capacity, or we find that they have policies that turn away, for example, young people or people who are intoxicated, or people who are disturbed, and that really isn't acceptable.
And Jana, the Care Quality Commission's report contained some warnings, didn't it? What were they?
Well, it said there are discrepancies across the region. For example, some people are turned away for being too drunk when perhaps they need the help the most. Some areas in our region only have 1 room, which could pose a problem. But the Care Quality Commission said that as long as the police and mental health services work together, then there shouldn't be a problem. And certainly we're seeing that, as you saw in my report, here in Birmingham and Solihull.
And Jana, thank you.